Good morning. My name is Anthony F Seychell. I work as a senior safety expert at EUROCONTROL Brussels in the safety unit there. I have been working there since 2007, and during these years I was mainly involved in helping ANSPs to implement safety management systems. Now we are talking more of improving the safety management systems. I will also help the ANSPs with part of their safety management work in some projects as well. In time, I was also involved, and I am still involved in the human factor side of things. And nowadays, besides the safety projects, I'm also delivering training at the EUROCONTROL Institute in Luxembourg in courses on safety management systems and team resource management. Before my time in EUROCONTROL, I was a safety manager as well at an ANSP. And then before becoming the safety manager, I was head of Aerodrome services at the ANSP. And before joining management, I was an air traffic controller. I had all the ratings possible, started with tower, moved to en route non-radar, then it was TMA radar, and finally it was en route radar. And during my time as an ATCO, I was also an on-job training instructor, OJTI, and also a local competency assessor. Before becoming an ATCO, I was an engineer. I actually worked 5 years as a mechanical engineer before deciding that it was not my line of work, and then moved to ATC as a new career, where I then stayed. Now, as I said, I'm working at EUROCONTROL, part of the safety unit in Brussels, and as part of the safety unit I have seen quite significantly and sometimes at close the effects of COVID-19. COVID-19 has been around for several months now. The impact it had on aviation was huge, and we have seen all the figures of traffic plummeting down to less than 10% of the previous COVID-19 figures. Aircraft parked on the ground and in boneyards. People having to either work from home or worse, being furloughed or losing their jobs. So there has been a significant influence on our way of operations. Now we seem to have passed the worst, and now we are going to starting slowly to return to normal operations. And we can see the return in the increase in traffic. So last week we were averaging around 5,300 flights a day. This is expected to go around 12,000 flights a day in the coming weeks, maybe at some time around mid or late July. The figures won't improve much after that, so the traffic levels of the pre-COVID-19 times are still some months, if not years away. Still, we need to manage this transition back to normal operations. So, as I said, I am working in the safety management field, so we need to do a safety assessment. EUROCONTROL has carried out the safety assessment as part of its return to normal operations plan. The plan is published every Friday, and part of that plan is a hazard assessment that was carried out and is still reviewed periodically to ensure that it's still applicable for the operations. The hazard identification had seen quite a number of hazards. One of them, and which is significant to my area of work, is the quality of the safety management work. The COVID-19 crisis has reduced the quality of the safety management work. Why? Simply because most of the staff were sent home. So they either had to do teleworking, working from home, or they actually furloughed. The reason being that most of them are considered as administration and not operational staff. So they were trying to do their work while not having access to many of their normal tools. The first to suffer were the investigation and follow-up processes. Luckily, the number of occurrences was low, in line with the reduced traffic, but the occurrence reports still had to be analyzed, still had to be classified and rated for their safety impact. Who would do this if the people are not around? Okay, some of them were being done from home, as I said before. There were also other serious investigations which had to be postponed because the staff were not there. So that was the first impact. Other processes had reduction as well. So the projects were stopped, many of them. But the few that continued still had to do the safety assessment. How do you do safety assessments of projects when most of your staff, most of your experts, not only your safety management experts, but also the subject matter experts are not around? The virtual meetings helped, and as they helped with other operational issues, but again, it was a very poor substitute of the face-to-face meeting. Holding a hazard identification session on a virtual meeting proved to be challenging at times. There are other difficulties in virtual meetings which have nothing to do with safety management, but they are common to all virtual meetings, that people find them more tiring than the normal face-to-face meetings as well. Then, how do you do safety audits and safety surveys? Again, ANSPs have resorted to audits online and surveys online, but the comment was there are no real substitute for a site visit. So COVID-19 has had a huge impact on our life, on the operations, and we are slowly returning to normal. And luckily, this return is gradual. Still, in some cases, the return was almost sudden. There were airfields, airports, mostly dealing with VFR traffic, that went from the 10% levels to 80% in a couple of days, and then jumping almost to 100%. Now, how do you deal with the situation when your rostering is still based on the COVID-19 sanitary measures, reduced staff, the physical distancing between the ATCOs working? So how do you suddenly go from this COVID-19 situation to the pre-COVID-19 when your traffic suddenly increases to 80% to the normal levels? And then, which procedures do you use? The COVID-19 procedures or the pre-COVID-19 procedures? Is everybody on the same wavelength and realize that now they have this traffic, they need to resort to the pre-COVID-19 measures? And who would make this decision? Will it be the supervisor or the management, or actually the duty ATCO? And this is now some of the questions that we are being asked. So COVID-19, hopefully the worst is over, but we still need to manage the transition to normal operations safely. Thank you. Good day.